Welcome everybody to today's webinar on monitoring and evaluation of reintegration. I am Lopa Bhattacharjee, the project coordinator for RISE Learning Network and the regional coordinator for South and Central Asia region. I'm joined here by my colleague Jade Tekimenson, the regional coordination advisor for the Sub-Saharan Africa region. I would specially like to welcome our panel of experts on monitoring and evaluation with focus on work with children. Our panelists include Tim Joel, who is the monitoring and evaluation team leader at Retrak Uganda. Tim is an economist with an MA in demography. He has more than 7 years of progressive employment and consultancy experience working for international organizations. In his presentation today, Tim will cover Retrak Uganda's integration status tool, which is used to track and understand the progress of reintegrated children and their caregivers within family and community settings. Our next panelist is Dr. Manish Sabharwal. He is a Chief Executive Officer of Impact Partners in Social Development from India. Dr. Manish Sabharwal holds a PhD degree in statistics and has over 20 years of experience in program development and M&E of social development projects. We also have with us Dana Rajwang, Senior Associate at African Institute for Children's Studies and Project Manager at Plan International Kenya. Dana Rajwang is a public health expert with postgraduate training in M&E and project cycle management. He is currently pursuing his master's in development studies. Danner has been managing projects, designing and implementing monitoring and evaluation systems, and conducting project evaluations for over 7 years in Kenya and parts of the Eastern Africa region. Finally, we have George Kisa. He is the Senior Associate at African Institute for Children's Studies and Program Manager at Hope Worldwide Kenya. George Kisa holds an MA in Education, Health Promotion and International Development. He has over 10 years experience in program management. In the last 5 years, he has been actively engaged in monitoring and evaluation consulting. Before we move on to today's session, I would like to give you a brief background about the RISE Learning Network, which is a project jointly implemented by Family for Every Child, a global alliance of national civil society organizations, Retrak, an international NGO working with street-connected children, and the International Center for Researching Child Sexual Exploitation, Violence and Trafficking in the University of Bedfordshire. The project is supported by O Foundation from 2015 to 2018. The RISE Learning Network aims to promote and facilitate learning on recovery and reintegration approaches that improve outcomes for children and adolescents affected by sexual exploitation. Today's webinar is the first of the series on the topic of monitoring and evaluation of reintegration of children. The focus of the discussion today is, why do we need to monitor and evaluate reintegration? What difference does it make? The format of the discussion will be such that we will first have a presentation on some of the key concepts of monitoring and evaluation and linking it to why it is important in the reintegration work. The presentation will be made by my colleague Jay. This will then be followed by our second presentation by our panelist Tim on the M&E tool used by Retrak Uganda. Following the presentations, we will open up the session for the question and answers from the audience. Over the presentation to my colleague Jade. Jade, over to you.
Thank you, Lopa. The presentation will cover the importance of monitoring and evaluating reintegration programs and briefly introduce this RISE Learning project. First of all, why monitor and evaluate reintegration programs, and why the need for this RISE project on M&E of reintegration of children? At the moment, there is much attention and resources being put into reintegrating different groups of children. However, there is still a lack of evidence concerning the effectiveness of these reintegration programs. And when evaluations do take place, the focus tends to be on the program objectives rather than on how and why activities benefited the child, as well as subsequent impact on families and communities. This gap has been highlighted by the Interagency Group on Children's Reintegration, as well as an earlier project on child recovery and reintegration funded by Oak Foundation called the Home Project, and an initial scoping on M&E practice done in the 3 subregions of RISE. Adequate efforts, therefore, must be made to monitor and evaluate programs in order to assess whether reintegration has been meaningfully achieved for the benefit of the children and their families who are being supported. Moreover, with finite resources available for reintegration work, such knowledge is necessary for practitioners, donors, and policymakers in order to advise on the most effective program models to fund, replicate, and scale up. In short, when M&E is done well, it can tell us not only what works, but how and for whom. So, moving on to the next slide. How do we define and understand reintegration? Reintegration is defined in the Interagency Guidelines for Children's Reintegration as the process of a separated child making what is anticipated to be a permanent transition back to his or her family and community in order to receive protection and care and to find a sense of belonging and purpose in all spheres of life. It's important to emphasize that reintegration is both a process and an outcome, meaning it's not just about the process of physically returning home, but also about the ultimate desired outcomes of the process, including the child experiencing positive changes such as being safe and cared for, feeling accepted, and having self-esteem and hope for the future. It should be added that reintegration is a complex process, and there is no one-size-fits-all reintegration journey. The length of the process will vary from child to child and involves working with families and communities, including local child protection systems. So going on to the next slide. Effective M&E of reintegration of children has to take into account the perspectives of said children in terms of what they also consider as meaningful reintegration. And this should further translate into incorporating relevant child-centered indicators for measuring progress and changes. And what you see on this slide are examples of definitions of reintegration given by young people who were part of a 2013 consultation organized by the Home Project. So you have, for instance, a young person in Uganda saying that from their point of view, reintegration encompasses being respected by people in society, financial independence, being a spokesperson or role model for other youth in the community, and having very good and trusted friends. Also, young people from survey stating that a successfully reintegrated child is a child that is healthy, loved, satisfied and laughing, living in a nonviolent family and attending school. And the last example from Albania defines reintegration in terms of having a safe house to live in, living independently or with family, having a job and feeling happy and safe. So how do we monitor and evaluate reintegration programs? First, it's good to define the 2 terms. The monitoring process is an ongoing routine assessment of a project or program that captures outputs and outcomes. Whereas an evaluation is a systematic and objective assessment of the project or program at one point in time, usually midterm and/or end term. In a way, monitoring functions mainly at the activity level, focusing on continuous oversight of program activities to make sure that intended results are being achieved and correction action is taken where necessary. On the other hand, evaluation functions more at the program level to assess the overall impact or effectiveness of a program or project. So in terms of methods for monitoring and evaluating programs, depending on your identified indicators being the quantitative and qualitative weights you'll be using to measure the changes resulting from program activities, there are different methods and tools that can be used to collect and analyze M&E data. Quantitative methods are numbers-based. They tend to be used to answer questions like how much and how many, and include data collected from registers, participation lists, surveys, and questionnaires. While qualitative methods express information in a narrative or descriptive format to help us understand why and how changes occur. Such methods include interviews, case studies, focus group discussions, and participatory tools. Finally, mixed methods combine the two elements by using both methods that collect qualitative and quantitative data. This approach often generates a good overall picture and allows for cross-checking through triangulation. Moving on to participatory methods. When conducting M&E of reintegration programs, it's important to involve the participation of beneficiaries. Hearing directly from children about what they think of your program and how it has helped them in their reintegration journey plays a fundamental role in ensuring that programs are being created and implemented according to children's self-expressed needs, interests, and opinions. It also enhances accountability on the part of service-providing organizations and may help to empower children whose views and opinions are being taken alongside those of service professionals. Given the type of information collected, participatory methods are often qualitative in nature and can include drawing, games and photography, film, and drama. It's important to add that no method is inherently participatory. It really depends on how the method is being used to draw out beneficiaries' perspectives. Also, effective participation of children in the M&E process should be informed by a consideration of the evolving capacities and circumstances of the child, as well as a commitment to understanding and recording information from the child's viewpoint, and of course, adoption of appropriate ethical protocols. In terms of getting started, if you're new to M&E, or you have only started collecting basic information about your program activities, it's advisable to start off with a simple M&E plan that collects relevant quantitative and qualitative information needed to get a more complete picture of the progress of your program or project's reintegration efforts. For example, to gather output results, create a simple table to allow you to track the number of activities you undertake each month and how many beneficiaries participate in these activities. To gather outcome results, pick a simple participatory tool to gather information about the changes in children's lives. Be sure to present your data in a clear way and create space for the information to be critically discussed in order for it to be useful. Also, when establishing a system to collect M&E data, it's crucial to take into account organizational capacity and resources and choose appropriate methods accordingly. I'll now talk briefly about this learning project and the RISE M&E of Reintegration Toolkit. At the core of the RISE Learning Project on M&E of Reintegration of Children is the community of learning. This virtual community of learning comprises NGOs in the 3 sub-regions of RISE, selected through an expression of interest process, who have committed to sharing existing practice and learning around effective M&E and trying out some new and innovative methods and approaches from the RISE Toolkit. In addition, through our website and webinars, we hope to engage a wider stakeholder base on this topic of M&E of reintegration of children, and also broadly disseminate the project's outputs. To this end, the RISE M&E Toolkit is a key available resource which provides information on what could be measured to assess reintegration and how this information could be collected. The toolkit is currently a draft document which will be updated with examples of promising practice and other lessons learned at the end of this project. Our overall aim, therefore, is for both the community of learning and toolkit to support strengthening of awareness and capacities of organizations on M&E of reintegration, in addition to capturing learning on good practice to positively influence wider policy and practice on the ground. We therefore invite you to find further information about the project and also access the toolkit through our website, and also share with us your thoughts and learning on this topic. If you have any questions, please also contact either me or Lopa. Our contact information is currently being displayed on the screen. Thank you.
Thank you, Jade, for that very interesting presentation explaining the basic concepts of why do we do M&E. I now welcome Tim to please start your presentation.
Okay. Good afternoon, everyone. This is Tim Joel from Retrak Uganda. I'm going to take you through our experience in monitoring and evaluation of reintegration programs that we have had here in Uganda. Retrak Uganda, we have been reintegrating children for the past over 10 years. We can talk about that. And we have been dealing with street-connected children, and our reintegration is always done in the best interest of the child. We looked at the various policies to govern our operations, which is supported by the quality standards here in Uganda, where we put the interest of the child first, and it shows clearly that for integration, you have to do it with the biological families. In instances where you fail to get the biological families of the child, then the next option to consider is the relatives. But at times you find it hard to trace the biological families as well as relatives. Then the other option is to put this child on foster care program for quite some time until this child reaches the age of 18, and this child is graduated to live independently with our support. So that is what we do. And our reintegration processes involves a lot or a series of activities. One, we first create awareness on the street to these street connected children on what we do. Then we create awareness on their safety and where they can get services that are very helpful to them. So when they pick up interest, then they come to our centers to see what we have been talking about. So at the centers, we provide them with services that are meant to prepare them socially, emotionally, uh, with the intention of taking them back home. And at the center, as we prepare them, and the children that are ready to move on to family-based care, the officers start to trace their families. When their families are traced, then they are placed back to care, and they are always followed up. And then we see that the families now can face time and can take the care or can take care of the child. Then family. So those our practice, our practice of M&E had been, it had been more on output, now output, tracking the numbers, how many children have we reached on the street, how many have we provided with services at the centers on the various services that we offer, then how many children have we placed. So majorly had been that. Then we had also been getting views that we offer to these children when they are on the street and when they are our centers, and then we also prepare them to take them back to care. We always get their views on our services. And as we support the families that we have placed the children under their care, we also get their views. So majorly in the practice, our practice on M&A. So the above information, we had been using it to make some evidence-based decision on how we can improve our programming. Next. So when we place these children here, the follow-up is the placement follow-up. It provides us an opportunity to see that the children that we have placed in their best interest. And the follow-up support that we always give, I'd already put it here, have been providing those income generating activities and also providing some emotional support and education support among others to prepare the families and the children so that the family still remains in the best interest of the child. So those have been our tailored activities after placing the child into the family-based care. Next, please. Now, as we are all aware, dealing with street-connected activities is really, you need to be on top all the time because the trends are changing and everything is really changing. So you need to be updated all the time. As a result of that, in 2015, we carried out a survey to find out what was on the street. And one of the things that we pulled out was some of the push factors bringing these children on the street. And as you can see, we came out with the other so many factors, but here we pulled out only 10. So those 10, we have arranged them in the order of ascendancy from the top to down. So the first factor was death of parents. Most of these children that have come onto the street, they experience the death of one or both of the parents. And the second one is about the physical beatings. The third, divorce. And those who were at school, they were not able to enjoy school, or some were not able to attend school. And the issue of food also came out very clearly. Others mentioned sexual abuse, especially with the girls that we work with, then emotional abuse, neglect or abuse by stepmother, low standards of living, migration to urban centers. As you look at those top 10 push factors, so if you look at those 10 push factors, we were able to sit down and say, now, we look at the reasons that are driving these children on the street. Are we addressing them? So if we move on to the next slide, you will see that how Retrak was able to sit down and come out with innovation. So Retrak sat down and asked itself, are we doing successful reintegration, and what can we base on to say that the reintegration was successful? And it came out very clearly that some of the issues were, of course, there were some answers that we were able to, the child was able to go back home. That means the reintegration was successful. On the other hand, the child was able to remain in the family-based care 1 year after reintegration, which is an element of success, and that the family was able to reconcile with the child. If you look at those three answers, it doesn't give you much information about successful reintegration. Because looking at that in the previous slide, our post-placement support, it looks more of the post-placement support and the post-placement M&E looks more of the hard drive, not the soft drive. So whereas we were so much into those issues to make the family resilient, the social aspect of it was not coming out clearly. And if you look at the top 10 reasons that push these children onto the street, the social aspects were much, as we can move and see in the next slide. Yeah, we saw that we were addressing the issues, partly the reasons that push these children onto the street, and we needed really to do more so that we address some of the issues that we highlighted in the research. Then the follow-up support, and yeah. So if you look at the reasons that pushed these children onto the street, they were death of parents, the enjoyment, or the issues of not able to attend school or not able to enjoy education. So it was one of the things that we prioritized. If these children are at school, as it came out in the study, are they enjoying education, or they are just being forced to do something against their will, which is not in their best interest? And if they are not enjoying education, how can we be in position to help them to enjoy education? That was one of the things that we pulled out, looking at the social well-being of these children. You will realize that most of the top factor was the death of the parents. And if you look at the death of the parents, that means these children are placed back either with the relatives or other arrangements like foster care. But if they are placed there, are they able to create friendship and resolve issues in a new environment? And the third one was parent-to-child attachment that we looked into, looking at the parent-to-child attachment. The push factors that we saw up there was about the death of the parents and the divorce. That means these children are placed with relatives and other arrangements, which is really totally new to this child. It's very important for Retrak, as it works with this child and the family, to know that attachment in terms of spending the time and giving support to the child, and also how does the child interact with the family. So that element of parent-to-child attachment was very important. Remember, we are also looking from both aspects. When we talked of social well-being, we are looking it from the child, and also we are looking it from the caregiver of this child. And when we talk to parent-to-child attachment, we are looking it from, that is from the child perspective, but from the caregivers, we are looking at the child-to-parent attachment. So we are able to look at all those issues from the child and the people who are taking care, who have the children have been placed under their care. We also looked it up there on the top push factors, and we see that most of these children that we place back, they are placed back in a totally new environment. But how are they able to cope with the new environment? So it was very imperative for Retrak Uganda to look at how is that child faring with the environment, which is very, very crucial for this child to stay back in family care. And the other aspect we looked into was emotional well-being and even the safety of the child and the caregiver. So we looked at those 6 areas which we are looking at for both the child and the caregiver. Whereas for the child, we are looking at all the 6, but for the caregivers, we started from the second domain, which is the social well-being. We left out education. So those were the issues that we looked into, and that brought us the notions of adopting the integration status tool. Because as I said earlier on, the post follow-up was looking more of the hard, was like a hard drive, leaving out social aspects. Initially, the post follow-up, M&E was so much into how is the family able to cope up with taking good care of the child and how is the child faring. So the tool that we are using was mostly, was majorly the CSI to see the progress on the household, which looks at the food and nutrition aspect, the shelter and care, protection, health, psychosocial education, and skills training. But it was not giving us exactly the surrounding issues around this child that were very, very critical for this child to stay back at home, not to come back onto the street again. So as I said, that brought the issues of adopting the integration status tool, which is applied to both the child and the caregiver to help the social workers explore those areas and come out with appropriate tailored activities to address some of the issues that are raised by the child and the caregiver. Yeah. Next slide. This tool, we adapted it early this year, and we are using it to understand how well the reintegrated children and caregivers feel within their families and communities. If you look at the 6 areas that are already identified, and those areas line with some of the push factors that we have identified to be pushing these children onto the street. So this tool is helping us to understand some of those domains that I've mentioned earlier on. and it looks at those areas I've already talked about. We are using it with the reintegrated families. Earlier on said we applied it to both the child and the caregivers, the reintegrated child and the caregivers, to understand the progress of reintegration. Our social workers and project officers are using this tool. We are not only using it to the reintegrated families, but we are also implementing a community project. The community project that we are implementing, we have identified some of the communities that are on the verge of sending children onto the street. So as we support them, we also monitor those aspects that I've earlier on said. So it's a two-strong aspect, whereas we are so much into taking children back into the family care, which is more of treating symptoms, but we also need to treat the root causes by preventing children from coming onto the street. So we are using that tool with the two scenarios, with the integrating families and also with the families that are on the verge of sending children onto the street. So yeah. So this tool is administered at a baseline, that is 4 to 6 weeks after placement, and we are doing it after every 6 months. Why is it that it's 4 to 6 weeks after placement? From the pretest, we realized that if you place a child today and you go back tomorrow to administer the tool, those domains that we have mentioned, education, parent-to-child attachment, emotional well-being, social well-being, community belongingness, and safety, it will not come out clearly because it's still a new environment to this child. You need some time for this child to settle, and you go back and find out how this child is faring. So that's why we are doing it 4 to 6 weeks after placement, and that acts as our baseline. Yeah. Next. I think, okay. And this integration status tool, as I said earlier on, it's a case management tool. It helps the social workers or the implementing officers to identify areas that is of interest that should be addressed. At the end of the day, data that is collected is collated and summarized. And if after summarizing the data, the project officers, the social workers, they sit down together with the child or the caregiver and they draw this chart. If you look at this chart, it is a case management for the implementing officer. The implementing officer looking at the 6 domains, which one is really performing badly. And it's upon that domain that the implementing officer sits down together with the caregiver or the child and dig out what is the real issues that are making this domain not to perform. If it's about parent-to-child attachment, if it is low, probably at 6. Why is it at 6? Yet it's supposed to be at 20. So that is something the implementing officer discussed together with the caregiver or the child, and they come out with the action plan, which is monitored and which is supported and monitored after a period of time. So I said earlier on, it's a case management tool in that sense to the implementing officer, but for the M&E aspect of it, we use it as an outcome monitoring tool, which is very crucial to answer some of the issues that are raised in the post factors, in the reasons that push these children onto the street. So the star chart you see there, it's very important for case management and also for outcome monitoring. Yeah. Next slide. What benefits have we realized from the tool? As I said earlier on, the tool is able to unearth some of the crucial factors that affect children's stay at home. Remember, when we talk about the enjoyment of education,
Are these children caring about school? Are they enjoying learning? What about the issues, the commitment of the child to do well at school? So it's able to pull out some of these issues. And when we talk about the parent-to-child attachment, is the parents or the caregiver doing things together in the way that this child enjoy and is giving love and support? Those are some of the things that we look into. So it is able to draw out most of these things, these crucial factors, so as it helps the implementing officer to help the family. As I said earlier on, the STAR part that we saw, the STAR, allows for a participatory discussion and action planning with the child and the caregiver. So you look at the area that is not doing well in the STAR and say, why is this area not doing well? So you sit down together and discuss why. Those are the concerns, and you come out with the action plans, which is followed up and monitored. Yeah. It also enables the social workers to sit together with the child and caregiver to plan for some of the interventions based on the identified gaps in some of those domains. And as I said earlier on, it's a case management tool. It's at outcome level. Yeah. Next slide, please. We have had a few issues with the tool. As we are all aware, not all the tools are that as fluent, as fluid as we think, but in terms of other aspects, we have had certain issues with the tool. It takes a bit around 45 minutes with the child and the caregiver. So in terms of the time, that is a little bit high. Remember the context in which we operate. We are operating in slum areas, and probably the caregivers are a bit doing other things. So they look at this 45 minutes as a long time, but also despite that it's a long time, but we are able to get good information. We consider some of the child protection related issues and create a very good rapport with these caregivers and the children, so that as we interact, they can also be doing other things. So that it look at these 45 minutes as not a long time. By the time they realize the minute is gone. And we are saying that the tool works well for children that are 9 years and above. But yeah, because you can ask them once and they are able to give you the responses as quick as possible. But for children that are 8 years, 9 years and below, you just need to be patient and consider a lot of ethical issues and child protection related issues. And you need to keep probing and repeating the questions. Yeah. Next. What lessons have we learned from the use of the tool? We are saying that for the child to open up, the tool should be delivered when the child is not near the caregiver. But remember, as you move the child away, you should need to sit with the child in the open where the caregiver can be seeing you people seated. So you need to consider ethical issues related to the child protection. And also the pre-assent, yeah, where a pre-consent. Whereas we would want the child to assent, but you need to get the pre-consent from the caregiver for you to interact with the child. So those are some of the things that we have learned, that if considered appropriately, the child will open up because they know that, okay, the caregiver is in support of this, so they will tell you everything. And because the caregiver is not near them, they're able to tell you the real issues. And we are saying that the tool enables social workers to pull out the real issues and at the same time provokes the caregiver and the child to explain scenarios which could have been missed. So those scenarios that explains why maybe certain ranking and not performing well is used in drawing out action plans to address some of the issues. Okay. The tool cannot be administered at the time when you are placing the child. I've already talked about the why and the reasons why, yeah. Then we have been saying that as a result of this pre-testing the tool and the time that we have had the tool, it has been adopted by some other partners already in Uganda here, as you see. They are using it for both the for reintegrating families and also for the prevention families, those families that are in the verge of sending children back onto the street. So the tools are now being used with those partners. And I tell you, the social workers are now saying that the tool is able to pull out some of all the issues that affect the child and the caregiver, which at first it was not coming out clearly, because there you go and see the child eating, looking at the CSI, and you may not be able to dig deep and deeper into some of these issues. But with the use of this integration tool, you are able to pull out the key things that affect the child and the caregiver. Yeah, that relationship, which is very, very important. Next. Yes, that is all about the tool. Then we shall be, yeah. Any questions in the Q&A sessions will be welcome. That is all about the tool. Yeah, thank you.
Thank you, Tim, for that very reflective presentation on using the integrated status tool and the STAR tool particularly. The session is now open for question and answers. I request you to please now post your questions to any of the panelists who are here today. But to start with, I will already start with three questions that we have already received from our learning partners prior to this webinar. So the first question is from TPO Uganda, who has asked the question, how can we integrate quality assurance in our M&E practices for reintegration projects, such as in data collection, especially with the dynamics of reintegration? And I think, Tim, you wanted to take this question. So over to you to please respond. And then I would also welcome other panelists to respond to this question if you may wish to.
Yes, thank you once again. This question came from TPO. The question was, how can we integrate quality assurance in our M&E practices for reintegration projects, such as in data collection, especially with the dynamics of reintegration? Yeah, as I already told you earlier on in the presentation, the trend in which the reintegration work is carried out is changing over a fortnight. So you need to be on top and know what is happening, where, and why those things are happening. First of all, you need to look at whether the services you are providing is meeting the needs of these children based on the push factors that are bringing these children on the street, and also why the organization exists. If it exists to reintegrate children back into family-based care, you look at some of those activities that can prepare them emotionally and socially so that they appreciate that home or the family-based care is the best option for them. Having looked at those services, you then need to realign yourself with the national quality standards. Each and every country has the quality standards that probably if you are offering services in such and such an area, you need to conform to. So having looked at the services that you are providing, then you look at the quality standards of the country. And sometimes it's very important that some of the things that we looked at as our own standards, and even that standards of the country, the children that we work with may not take it as something very important to them in terms of standards. So as we consult the National Quality Standards Guideline, we also need to find out from children and caregivers what they think of being quality in the services that you are providing. Then you can be able to triangulate all those and come out with the services that are tailored to the needs of these children. Then, having reached that point, then you need to develop the tool that really that can give you the information on the issues that you want. So the tool should align with uh, give you the valid information based on the services that these services that you are providing that conforms to the national standard and also to the beneficiary standards in terms of quality. And you look at the tool, is it capturing that information? Then you should be able to see the friendliness of these tools when you are administering these tools. Are the tools friendly enough to the children and the caregivers? If they are not friendly to them, then how can you make it friendly, considering all the issues, the ethicals, the child protection issues, so that the data you are going to get is of good quality. So the validity of the tool is really very important. And when we looked at the quality, we may be providing the standards, the quality standards that is appreciated by the national guideline and also by the children or the caregivers that we are supporting. But is the information that you are getting, is it coming in a timely manner? Because if the information is not coming in a timely manner, really it would be very difficult for you to even come out and say that you are providing a quality information. So if the information is coming in a timely manner, then you are able to make a decision based on what you have found. So this brings about the friendliness of the tool, linking the friendliness of the tool, and also your logical framework should consider all those issues that we are talking about. So getting the views from the caregivers and children, that brings the issue of participatory M&E, and you are able to get their views. Whereas they say that this is what we need to be the service which is of good quality, but with time you also need to get their feedback. Do they still feel that this is of good quality to them? But remember also the resources and everything. The demand may be too high, but you need to come to a compromise somewhere, somehow. So you don't go with everything that I think this is good quality. Then you need to compromise and sit down and agree together that probably, yeah, we can provide this. Then you continue to monitor the trends on the street and ensure that you are capturing the information that you want to capture based on the in your logical framework. So the issue of quality is looked at those aspects, and the quality is to ensure that you are addressing the root causes rather than the symptoms. So if the services are addressing the root causes of the push factors, then the tool should be able to look at that. So it's a two-way thing from the programming aspect, linking the programming and also with the tools that you have. With the tool, with the logical framework, it's very important, yeah.
Thank you, Tim, for responding to the question. Before we move on to the next question, I would also like to now invite Manish and Danner to give your views on why do we do monitoring and evaluation from your perspectives, to adding on to Tim's points. Over to you, Manish, and then Danner.
Thank you, Lopa. Very quickly to respond to this, add to the response that Tim has just provided about the quality of the information. I think one of the very important component is to ensure the integrity of the data that we capture. In situations like these, where we encounter these situations, a lot of the times we would see that parents or children would hide certain facts or may not reveal the true situation on the ground, particularly when you are going there for follow-up. Then not everything may be clear or may be clearly told to you. So I think when we are developing these tools, it will be good to have some possibilities of getting information from more than one source and then triangulating that information so that it is possible for us to see from different channels what kind of information are we getting and what is the most authentic or most useful information that that we are getting.
Daniel, would you like to add in your point?
Yeah, thank you very much. And I think the discussions are quite worthy. And I wanted to add just a few things. The specific question was related to reintegration and why it's important to sort of monitor it. And I think if you look at the reason why children move away from their homes, they are quite pertinent issues. And if we're going to take children back to their homes and we're not in a position to monitor that, then we are making these children more vulnerable. And for me, that is the core thing, and that is the business why it is very important that any reintegration program is monitored. So that is what I wanted to add. I don't want to repeat everything else that has been said. And then I wanted to also respond to the quality question. And I wanted to respond in this way. One, I think for you to ensure that there is quality, and especially in data collection, first of all, you have to assess the need for data. What data do you need to inform your intervention? And then the second bit is the tool. You have to assess the tool and ensure that that tool that you have is actually giving you the data that responds to your information needs. And then the third one, remember, after developing a tool, then there has to be a method that is used to administer that tool. So you want to again look at the methods and ensure that those methods are appropriate to use the tools to be able to generate the information. You don't want to develop a tool and then use a different method that would then refuse the tool its full utilization. And then another important component is the team that are going to be using the tools and are going to be adopting the methods. You want to make sure that everybody has a common understanding of what the information needs are, of what the tools look like and how they're supposed to be used, and what methods are supposed to be employed. And you must make sure that that understanding is common, even among the teams that are responsible for ensuring that that data is collected. And then finally is the use. Most of the time we collect a lot of information that we end up not using, or they end up just resting somewhere. And I think you want to ensure that when you're collecting information, then that information is going to be used to make decisions. And therefore quality becomes key. And if that information is not going to be used, then it's going to take you back to the question of whether you need it or not. So I think those are some of the factors that if we're putting into consideration, then we are able to ensure that quality assurance is entrenched into our MD. Thank you.
Thank you, Danor. We'll move on to our next question, which came in from Lifeline Childline Zambia. And the question is, how best can we monitor the progress of the children who have been reintegrated?
I could take that and perhaps respond that the presentation that Tim provided, in my opinion, was able to address that question, unless perhaps the participant has some additional questions to follow. But I thought that what Tim presented was very good at addressing the issues of monitoring children who've been reintegrated.
Thank you, George. Anybody of our panelists would want to respond to that, or we'll move on to the next question. Our next question is, how can we best judge that the monitoring and evaluation tools used are responding well to our project outcomes? I think George wanted to take up this question.
Okay, sure, thank you. There are various ways we could do this, but we have to come up with a logical way of doing it. Personally, I prefer using an evaluation matrix because it allows me to look at the anticipated outcomes and then come up, evaluation questions. For example, one of the outcomes I saw in the presentation was something like integrated children are retained in their homes for at least 12 months. If that's an outcome we're looking at, then I may want to ask something like, to what extent were the integrated children retained? And then that allows us to ask ourselves, how frequently are we monitoring? In this case, in Tim's presentation, it was like every 6 months, that's when they visit the homes. Then I can look at the tools we capture and ask ourselves, which indicators are we interested in? One might just be a simple register of all the children who've been reintegrated to form like a denominator, and then have a tool that simply asks whether the child is still within the home each time that these visits are done, and then a simple proportion is calculated. So just having a logical system that looks at all the outcomes and goes backwards towards the tools to see whether each of these is captured is a method that we can use. Maybe other panelists could also add to that question.
Thank you, George. Our next question is from Yashoda, and she asks, how do we do follow-ups of reintegrated children?
I think that is partly covered in the presentation that I made, in the sense that after placing the child back into the family-based care, you looked at some of the push factors, and those are the push factors that you keep monitoring and also be able to strengthen the families to be able to take care of this child. So the post follow-up support is very important, and the post monitoring is also very important to see that the placement is still in the best interest of the child, and this child is able to transition or integrate within the families or within the community, and in whatever, maybe the community and the school very well. So looking at those push factors, it's upon those push factors that you rotate on following up on this child. So it depends on what you identified during placement, and those are the action plans that you generate based on those identified issues, and you keep following up, but also looking at the social factors that I've mentioned earlier on.
Thank you, Tim. I think Manish would also like to add into this response.
Yeah, when we're talking about the follow-up, there are two distinct pieces to it. One is about what do you follow up, and the second is how do you follow up. And both these things are important. When we talking about what, I think broadly the bottom line should be that we need to see what kind of vulnerabilities the child had when the child moved away from the family, and what was the situation of the family when the child was reintegrated. Did that vulnerability increase or decrease at the time when the child was reintegrated? And then it is important to monitor regularly what are those vulnerability factors, like the push factors, the pull factors, which are changing, and also what efforts these families are deliberately putting in to reduce the vulnerability of those children. So that, I think, is the what part of it. In terms of how part of it, the best way, of course, is to keep visiting the families, but it gets very difficult, at least in Indian context, because we have seen when in Indian context, we have actually seen that when the number of children to be followed up gets large enough, then physical visits have been very difficult. People have used phone calls at times to get in touch with the families. This has worked in some cases, but many a times you are not very sure about the information that you're getting over phone, to what extent that information is correct. So therefore, and as I mentioned earlier also, the best way would be to have a physical visit by somebody to the family. The best way would be to be visiting the family, somebody physically visiting the family, and getting some information from the surroundings as well. Not just believing in what the family is saying, but getting some information from the surroundings as well. So I think these are the two components which can help. Over.
Thank you, Manish. Our next question is from Lekwas, who has asked about the link between the child status index and the integrated status tool, and if the child status index is why the integration status tool was developed.
I can respond on that, and other colleagues of mine can add on. As I said earlier on, we said that the post follow-up support was more of providing ideas, that is income generating activities and other services. So the tool that we were using was the CSI to see how the family was coping up in terms of food and nutrition, and also in terms of shelter and care, protection, the health of the child, the psychosocial aspect, which looks at emotional health, social behavior, education and skills training. And if you look at some of the push factors that push these children onto the street, we appreciate the CSI can give you much of the information, but looking at the integration tool, you are able to dig deep and deeper and find out what is the real issue and why is that issue existing, and you sit down with the people, the child and the caregiver, and you are able to come out with the action plan. So this is more of it's a social aspect, whereas the CSI looks at both the aspect of the food and nutrition, the hard aspect and the social, but this integration tool look at really the environment around this child that are very critical, that are ignored. Yeah.
Thank you, Tim. Our next question is from Muluken, and he's asking, how long should monitoring last? And Daniel, would you like to take up this question, please?
Yes. I think taking that question, if you look at the definition of monitoring, it's something that is continuous. And it would proceed as long as the project lasts. And therefore, there is no specific period that you'd say, I'm going to do monitoring just for this period and then stop. I mean, it runs along with the project, because then you're collecting day-to-day information, you're analyzing it and making decisions on a day-to-day basis. And that is going to go on and on as long as the project lasts and even beyond. But again, I also wanted to add something slight on the relationship between CSI and this tool. If you look at CSI form, it has everything to do with the well-being of a child. And if you look at the definition again of reintegration, then it brings out everything to do with a child. So I think there's a strong correlation between the two. It's the reintegration tool that I think borrowed a lot from the CSI. And therefore, in terms of connection, I think they're strongly, connected. Thank you.
Thank you, Daniel.
Perhaps I could just make sure we got Muluken's question right. I think Muluken was asking how long should monitoring come to an end, perhaps in the context of following up the child to make sure that they are still in the home for how long would that be last? Is that what the question was? That was the way I understood the question. Not monitoring in general, but perhaps in the context of how long should I follow up a child who's been reintegrated, then say now I think I can stop following up the child.
Yeah, I can jump in. As my colleague said, that monitoring is a continuous process. As you see, after placement, you identify the push factors and you work on those push factors with the child and the caregiver. So long as the child and the caregiver are still receiving your support, the monitoring and evaluation continues through follow-up and the rest. But also when you are created enough resilience within the family so that the family take care of this child independently, then you can phase out this family. So monitoring stops after some time when you have phased out this family. When you phase out, you continue to monitor after some time without your support. And now if the family is moving on well, then that is the point when monitoring stops. So after phase out, like 6 months after phase out, or year after phase out, and we know that the family is running on smoothly, is resilient enough socially, economically to take care of the child. Yeah.
Thank you, Tim. Thank you for further clarifying on that response. Our next question is also for Tim, again from Lifeline. And the question is, how do you assess the families of foster care in terms of security and capability of taking care of the child's needs?
Foster care is a very dynamic and complex thing. So there are a lot of processes that are involved. For you to choose a foster carer, you need to consider a lot of things, and it's something you cannot do alone. You have to do it with the stakeholders, such as the government people and other private organizations, and even the community around. So there is a lot of things you need to consider that is in the best interest of the child, but you also consider that all those aspects that can bring the risk to the child are limited, are minimized. So it's really a lot of things to consider. It is like a kind of a big thing, procedures that you have to follow. And if we are to have it in this kind of meeting, I think it can take us like a week. So you consider a lot of things, but in the best interest of the child. And you don't work alone. You involve a lot of people, government people, to approve each and every processes that you go through. And the child should also assent to that. And after like a pre-visit, the child should assent and say, okay, this is the best place for me to stay for now. Yeah, and you consider the support to the child and the caregiver, the foster carer. So it's really a lot of things to consider that may need a meeting on its own.
Thank you, Tim. Daniel would like to add in to this response.
Yeah, I think when you're talking about foster care, then it's just one of the alternative forms of care for children that are probably without their parents. And I just wanted to mention, in addition to what Tim has said, that you know, in every region or probably every country has, you know, policies around foster care and alternative forms of care. So even as you're considering this, you want to make sure that you're conforming to the local policies, if they exist.
Thank you, Daniel. A very, very relevant point. Our next question is there a particular tool or module to monitor children below 10 years?
For us, we as Retrak Uganda, we work with children that are 7 years to 17. So the integration tool works for us, but with that exception that those who are 7 to 9 years, you need to probe and be patient with them. I'm not sure about below 7 years, but from 7 to 17, integration tool works. But below 7 years, I'm not sure about that. We have not tried.
Our next question is from HP, and who asks how to conduct follow-ups when there are geographic challenges to reaching the child. And Manish, would you like to take that question?
Thank you, Lopa. Yes, and there's a very similar question by another participant about the, the remote areas and transportation amenities. So both these questions I'll try to attend to. In a country like India, there is a huge problem of physical follow-ups and verifications of families because it is such a vast country. Many organizations in India have developed an informal network among themselves, and they keep each other in the loop while reintegrating the children that they have rescued. So, if an organization from Hyderabad, for example, down south India, is reintegrating a child in West Bengal, then they have a contact organization in West Bengal, and they kind of hand over the child to that organization and say, please, for the child's sake, would you be able to do that follow up for some time? And organizations don't mind doing that, because sometimes this could be other way around, that the West Bengal organization would have reintegrated somebody down south in Hyderabad, and this favor can be returned at any given point in time. So that is one way uh, how this has happened. And another way is to look at government institutions and structures through which reintegration happens. For example, in India, we have child protection committees, child welfare committees, who are mandated to support different organizations in issues like reintegration and its follow-up. So I think those are some of the government structures which can also be used for these purposes. Over.
Thank you, Manish. Thank you for that response. Um, our next question is slightly a broader question, which is from Muluken, and who asks how to approach reintegration of children in situations where children have been sexually abused by close family members.
Perhaps I could respond, and then maybe Tim could add into that. Just like Tim presented, every reintegration or any action anyway involving a child has to be in the best interest of the child. So it's probably not a very straightforward question until we look at all the aspects for each of the cases, so that it can be determined whether reintegrating that child back to the same family is in the best interest of the child. For example, in a case where perhaps an uncle or father has sexually abused a child and they've been put away, then the child may still be able to live with the parent, with the mom. So I guess it's a case-by-case question, but the guiding principle has to be in the best interest of the child.
Thank you, George.
Yeah, I think George has answered it well. Everything should be in the best interest of the child, but you also have to see other associated risks around that. The child may not be able to see it, that probably they think something will happen, but as an experienced social worker, you are also able to judge and get enough information and explore whether placing the child back there can be in the best interest of the child if the child has not realized that. So it's really a lot of experience from the social workers to do that. Remember, we are considering family-based care. We may not necessarily need to take the child back to that same family uncle, but can we be able to consider another relative, place the child there temporarily while we work on the root cause to address this before the child is placed back. So you consider a lot of options. Yeah.
Thank you. Thank you, Tim and George. Manish would also like to add into this question.
In Indian system of reintegration, there is a mandatory component called home investigation, which means that an organization, before the child is reintegrated with the family, and somebody from the organization or government has to visit the family physically and do an investigation with the family, make an assessment how safe is the family for the child to be reintegrated back. come back and submit a formal report. And only if this report approves that the child, if only if this report approves that the child will be safe back in the family, the reintegration orders are passed. So this is a one very important filter, I would say, which is adopted, and if adopted properly, can deal with this whole problem of sexual abuse in the family. Over.
Thank you, Manish. Our last question for today's session is from Priyanka, who asks if doing reintegration in partnership with other organizations, do we have to use the same tools amongst the partner organizations? And George, would you like to take that question, please?
Okay, sure, I will. It depends. Partnerships can vary depending on how close a partnership is, but at least it will be good to agree on a few critical indicators that you want to track the same way. The ones that can allow when the movement of a child from one organizations are monitored into another, that it can still be able to track the same kind of indicators. So even if the tools are not the same, at least certain aspects that are critical should be similar. But if possible, if they are the same, that would be great.
Thank you, George. Daniel would also like to add in to this question.
Yeah, I think at the initial stages, even before partnership, there are a few things that have to be agreed upon, and that includes even an MOU that states clearly the terms and conditions of the partnership. And I think harmonizing the tools and ensuring that you're not confusing the child is also important. At the same time, you want to ensure that whatever you're doing is sort of feeding into what the other person is doing. So I think whether or not you're using the same tool is not the question. The question is the tools that you're using, are they harmonized, and are they giving you the information that you want to collect?
Thank you, Daniel. So we have come to the end of today's webinar, and I would now like to close this session by thanking our expert panelists, my colleague Jade, and our audience who participated in this webinar. This is also to let you know that the webinar recording will be made available in our RISE website very soon. And we really hope that you found this session useful and your questions has been answered. We also welcome you to share your experiences and learning around monitoring and evaluation, as earlier mentioned by Jade, through our website and through the community of RISE. And thank you once again, and do stay connected with RISE. Thank you.